First and foremost, you need to decide your area of interest. What is it that you are curious about? What is it that you are interested in doing? Now, it will differ depending upon your elective. If it is musculoskeletal and you are interested in doing something related to knee, or if there is some intervention that you are keen to do research on, you have come across a certain group of patients, some condition that you want to do your research on. For example, you are interested in doing something related to Mulligan mobilization. You want to compare that technique with some other technique and see if it works or not. Or you are interested in doing your research on patients with chronic ankle instability. So, like this, you have to find out what is it that you are interested about. Now, if you already have something in mind, it's good. But if you don't have anything in mind right now, then you need to find out. And how will you do that? By reading and reviewing different articles. It is important to have something that you are wanting, you want to do, or you are interested in doing, because research is like an ocean. It's vast, it's deep. Without a direction, you will get lost. You need to have some anchor that gives you a direction. And that is the reason why this first step becomes extremely important. Now, it is not necessary that whatever you think of right now is going to be your final topic. Right now, you just need a direction. Whatever you decide right now, it is not necessary that that will be your final topic. For example, you decide that you need to do something related to ankle and you start reading more about it. But now you are interested in doing some intervention in other joint, which is absolutely normal, and that is how you reach your research topic. When I was deciding my topic for research, I had started with low back pain. So I was interested in doing some intervention. I want to do some intervention in low back pain patients. But then I switched to sports. I then decided that I should do something related to football players. And finally, I took something completely different. I decided to do something related to knee in patients with ONE. So that is how you reach your topic. It's not a one-step process, but a journey. Step number 2 is to review the existing literature. Now you have some rough topic in your mind. You have at least a certain joint that you are interested in doing your research on, or some intervention or some population group that you are keen to do your research on. Now you need to refine or go deeper. You need to go through all the articles that are available on that topic. For example, if I want to do something related to the shoulder, I will go through all the interventions that have been done related to different conditions of the shoulder. There are different conditions: adhesive capsulitis, Bankard's lesion, rotator cuff repair, rotator cuff tendinitis, and so on. So you need to go through all the articles, see which interventions have been done in which patient population. So you make a list, whatever population group has been chosen, whatever condition has been chosen. By population group, I mean if a certain if a certain occupation is chosen, for example IT workers, or if a certain gender specific or if a gender specific population is chosen, males, females, and so on. So now in this second step, you are going to go one step further by deciding what is it that you are actually going to do. If you are interested in doing something related to sports, then what will be your population group? Are you going to do it in cricketers, football players, badminton players? What are you going to do? Are you going to give them some intervention, or are you going to observe? Now, there are two types of studies: interventional and observational. Interventional is the one in which you give treatment to the patients and you observe the effect of that over certain parameters. Observational is where you don't give any treatment, you just observe or see the correlation of the different variables. They can be so now, depending upon the type of research that you want to do, the type of study design that you want to do, that you want to take, interventional or observational, you need to decide how you are going to go further. If you want to do something related to low back pain, so what is the condition that you're going to select? Chronic low back pain or piriformis syndrome. Then what is the intervention that you're going to give, and so on. Next is identifying the gap in the existing literature. So continuing with the same example, if I have now decided that I want to take up two interventions, muscle energy technique and Spencer technique, and I want to see the effect of these two interventions in patients with adhesive capsulitis. So the interventions that I've taken are muscle energy technique and Spencer technique, and the on the condition that I've chosen is adhesive capsulitis. Now I want to see the effect of these two interventions on pain, function, range of motion, whichever outcome measure you want to select, you can. So now this is the rough idea that I have in mind. Now I will find out what is it that is missing in the existing literature. What I mean by this, you will go through all the studies once again and see what has not been done. If this study has already been done, you cannot go ahead with it. You will have to either change the condition. So if it has been done in adhesive capsulitis, you can take up some other condition in which it might be effective, or in which you want to see if it works or not, and or if some outcome measure can be changed. So if this study has been done where pain and range of motion has been compared, you can use some other outcome measure, and so on. You decide right now how are you going to go ahead with the research. So you will come to know this by reading the articles. Every article you will have to go through the limitations section. Every article has its limitations, and by reading that you will understand that what has not been done in that study. For example, the sample size was not enough, the sample size was small, so that is one limitation. So if you want to do your study, you can take up a larger sample size, or this particular parameter was not compared in this particular study. So future scope, so in the certain studies, majority of the studies have future scope also, which means that they give the things that can be done in future related to this study. So you can go ahead with that, you can take up something from that. So limitations is the section that you need to read. You need to find out what was not done in this study and what you can do in the future, what you can do in your study. For example, if I want to see the effect of mobilization, I want to see the effect of carton bone mobilization and Maitland mobilization in ONE, and that study has already been done. So you can take up some other intervention. If carton bone and Mulligan has been done, you can take Maitland, and so on. You have to decide what has not been done and what you can do. Next, you need to establish the need of the study. You need to have a strong why. Why are you doing your research? Why have you taken up that topic? What is the need of the study? Simply taking up a topic just for the sake of doing it is not going to help. You need to have a proper reasoning for why have you taken, if you are doing an interventional study, why have you taken up those two interventions? Why have you chosen those interventions in that specific condition? What is the population that you have chosen? Why have you chosen it? If you are doing a correlational study, which is an observational study, why are you correlating those two outcomes? What are you seeing? What are you correlating? And what is the need of your study? So that is how you need to, those are the questions that you need to ask, and it is an important aspect because that gives meaning to your research. So far, if you have followed all the steps, you will be clear on what type of study you're going to do, whether it is interventional or observational. If interventional, what are the interventions that you're going to give? If observational, what are the parameters that you're going to observe? Next, what is going to be your patient population? What is going to be your outcome measure? What is an outcome measure? For example, if I want to see the effect of certain intervention on pain, so how am I going to objectively check on the patient? How am I going to quantify that variable? For pain, NPRS is a scale which is commonly used. There are different ways in which you can objectively check. So you need to find out which one is the most effective. Again, for that you will have to go through the articles. If I want to check proprioception, how am I going to see? If I want to see the patient's improvement in activities of daily living, what am I going to do? Which scale am I going to take? So this is how you are going to decide your outcome measure. Next and the most important thing is the feasibility of your research. Whether it is feasible for you to go ahead with your research. Whatever patient population that you have chosen, do you have access to them? If you have chosen a condition that is rare, where are you going to find those patients? Because those patients will not be available, you will not be able to find those patients in the OPD or hospital. For example, if you have taken your population as cervical dystonia, now these kinds of patients you will not find in the OPD or hospital. So therefore you need to think all of this, you need to have all of this in mind. Whatever intervention that you are going to give, is it possible for you to go ahead with that in the clinical setup? If you are using some equipment, is it affordable? All these questions have to be thought of. And lastly, it is important to discuss all of this with your guide. Only if the guide is convinced will you be able to go ahead with the topic. So it is important that whatever research you have done, whatever review you have done, you discuss it with your guide, you try to convince them of your topic and then finalize the research.